Welcome to Let's Talk About Dogs. Today we're here with Dr. Leslie Anderman at Anderman Animal Clinic. How are you?
I'm doing great.
Everything's being rebuilt and redone?
Yes, we had a brief pause in business due to the flooding, but we just sustained minimal damage and we're back up and running, so everything's wonderful.
Awesome. So when I contacted you for the interview and asked you if there was a specific topic that you thought would be very important right now, you mentioned
Heartworm
heartworms.
disease.
So what is heartworm disease?
Basically, heartworm disease is a disease where pets contract worms through the bite of an infected mosquito. It's very common in areas like the South, Southeast Louisiana, any kind of tropical climate where a climate is favorable for mosquito production and high mosquito populations. That's probably one of the biggest things that we combat as veterinarians in South Louisiana is heartworm disease. We have such a high incidence of it. We see it all the time. Especially in this area, we've seen a huge surge of it since the flood because all that standing water, the mosquito population just went crazy. They're they're out of control right now. The parish and the city, they're trying as best as they can to spray and keep up with it, but we had such a surge that the mosquito population just tripled, quadrupled overnight.
Right.
And mosquitoes bite an infected dog who has larvae, microfilaria, heartworm larvae in their bloodstream. And then the mosquito will harbor those little larvae in their tummy or in their mouth parts. And then they'll go bite a dog. And when they go to suck blood, the larvae can come out of their mouth parts and into the dog that they're biting. And when that happens, the larvae go through the bloodstream. And then 6 months later, they will turn into adult heartworms that will eventually, through the long journey process, through all the veins and everything, end up in the heart, and they reside in the heart.
So technically you said about 6 months from infestation to manifestation.
Yes. Technically 6 months from the time of the bite till the time that that dog, when we draw the blood at the clinic, will test positive for heartworm disease. When we test for the antigen, which is the actual presence of the offending pathogen in the bloodstream.
Okay.
So we usually test every year. It's recommended by the American Heartworm Society to test a dog's blood, both antigen test and microfilaria test. So that means we use a commercial test kit. I should have one right here. Several companies make a commercial test kit. This is one made by Abaxis. It is a very simple test kit. We draw the dog's blood. We place a drop of sample here, and then we have to squirt a buffer in there. And then it travels across, has a chemical reaction, and then it will let us know if that dog has adult heartworms present in their heart. And another test that we do is called the microfilaria test, where we take the dog's blood and then we look at it on a blood smear directly in the microscope, and we check for the larvae of the heartworms.
Okay.
So that gives us an idea of, yes, we do have adults in the heart, and then we check to see if there are microfilaria present in the blood, because if they choose to treat, that kind of affects, what level of infestation they have, and it kind of, it helps us to figure out how to treat them a little better, so we get an idea of their disease.
So with 6 months from infestation to manifestation, how often should we treat for heartworm or give a preventative?
So it's recommended to give a preventative, as products label. Most products are labeled for every 30 days administration. So most of our clients just give it on the same day every month, like the 1st or the 15th, something that's really easy to remember. So that's what it's recommended.
And you test them how often when they come in?
We test them annually. We usually do that with their annual vaccines. Now, some clinics test them biannually, but we just follow the protocols of the American Heartworm Society, so we test them annually. If they have been off of prevention for more than, 5 or 6 months, we'll test them and then retest them again in 6 months.
Okay. What are the symptoms of heartworm? If somebody hadn't had their dog tested or whatever, what can they look for?
Initially, this is the tricky part. Initially, when your dog is infected with heartworm disease or infected with heartworm larvae and microfilaria, there are no symptoms.
Okay.
They only start to show clinical signs when the worm start wreaking havoc in the body.
Mm-hmm.
Either the larvae or the whipping of the tail, damage the heart valves,
Mm-hmm.
or the body, the bacteria, the certain bacteria,
Mm-hmm.
Wolbachia, that live on the heartworms,
Mm-hmm.
they can cause a reaction, and your lung tissues can get inflamed, and you
Mm-hmm.
can see like an immune reaction, or you can see well, we can't see, but you can see the effects in the dog. You can see them start to go into basically a congestive heart failure,
Mm-hmm.
because the worms, the adult worms, like to live in the pulmonary artery here. This is a representation of a dog heart. These are the lungs, and this is his pulmonary artery coming out from the heart and going towards the lungs. And these heartworms, they live in this artery, and they'll clog up the valves of the heart. They can whip around, and they cause damage to the heart valves, and they cause pressure gradients, which you see side effects in the lungs, and also the pressure gradients and the damage, and just the heart cannot function like it should because it's clogged with worms. That's when you can see them go into heart failure.
Mm-hmm.
And you see the exact signs of exact same signs as heart failure. You see coughing,
Mm-hmm.
you see exercise intolerance, you see syncope, which is just a fancy word for fainting.
Okay.
You can see them having shortness of breath.
Mm-hmm.
There are different stages of progression of actual heartworm disease.
Mm-hmm.
So at the beginning, you just may see a cough every now and then. Yeah, you
Mm-hmm.
may think nothing of it.
Mm-hmm.
Later on, you may see more chronic cough day and
Mm-hmm.
night. You maybe see them cough up blood. You may
Mm-hmm.
see um, in end-stage cable syndrome, which is when the heartworms really start wreaking havoc and
Mm-hmm.
clogging up the heart. You can see them have a dark brown to red tinged urine.
Okay.
You see them coughing up blood. You
Mm-hmm.
see their gums may start to be pale. You see lethargy, collapse, fainting, stuff like that.
Okay. What are the treatment options for heartworm
Okay,
treatment?
so when your dog is diagnosed with heartworms, that's one reason why we do, this twofold testing, the
Mm-hmm.
antigen and the microfilaria, so we can get an idea. Is there a large amount of microfilaria? Is
Mm-hmm.
there, we look at the gradient of the positive test. Is it a very strong positive, or is it just a very light positive,
Mm-hmm.
which may kind of give you an inclination to how many. Obviously, the scholars will tell you that's no indication, but we in clinical practice, we've seen that line be super dark, or we've seen it be so faint, but still
Mm-hmm.
we treat them all like, they're positive. It's like a pregnancy test.
Mm-hmm.
Positive is positive. And it's not good to have heartworms, but we see it a lot in South
Mm-hmm.
Louisiana. So we use that information to design treatment protocols.
Okay.
So we go by the American Heartworm Society protocol, what they advise. Basically, you start them on, so this would be technically the fast kill. They
Okay.
recommend get the worms out the fastest way possible,
Okay.
fastest and safest way possible.
Mm-hmm.
So you start them on preventative,
Mm-hmm.
because you don't want the pet to get any more.
Mm-hmm.
And then usually, if they have a lot of microfilaria present, when we start them on preventative, I always do a round of steroids, prednisone,
Mm-hmm.
to decrease inflammation and to prevent against any secondary reactions the body might have
Mm-hmm.
to the dying larvae in the blood.
Okay.
And then we also start them on an antibiotic called doxycycline,
Mm-hmm.
which it helps decrease levels of a bacteria called Wolbachia.
Mm-hmm.
And that bacteria, some people say the heartworms they're associated with the heartworms. And when you decrease that bacteria, it makes their environment for living a little bit less favorable.
Okay.
So it kind of weakens the heartworm. So we start them on the months of the doxycycline,
Mm-hmm.
and then we start them on the prevention and the prednisone.
Mm-hmm.
And then 2 months later, we do the first injection.
Okay.
The injection therapy is the drug called imiticide,
Mm-hmm.
and you inject it into a back muscle, the paxial muscles.
Okay.
And then we keep them in the hospital for that day to make sure they don't have any reactions.
Mm-hmm.
And this treatment is when it's super important that you restrict activity of your pet, because it is a fast kill treatment. It is designed to rapidly kill the worms inside of the heart.
Mm-hmm.
So there always is the incidence of, as the worms die, little piece can break off. You can have a
Mm-hmm.
clot.
Mm-hmm.
You can have detrimental repercussions to that. That's why it's really important to have that dog calm throughout the whole treatment so that the blood pressure doesn't rise and they have secondary complications. That alone is probably what prohibits a lot of people from choosing that fast kill option.
And this is when crate training can be majorly important, along with those
Exactly.
chew toys and other little puzzle games or something that's calm and relaxing, but yet keep them occupied.
Exactly. So we push the fast kill treatment because obviously you want to get the worms out the
Right.
fastest, because the longer they're in there, they're whipping around doing damage, and the immune system doesn't like it, so the immune system's reacting to it. But you do have to do that 3 to 4 month cage restriction.
So, how many injections is it in that therapy treatment?
A total of 3.
Okay.
So your first injection is going to be 60 days after you start the treatment protocol. You're going to come to the hospital, stay a day for that first injection in the apaxial muscle, in the back muscle of the dog. That's when you go home, crate restriction. And then a month later, you return to the hospital and you do 2 back-to-back injections 24 hours apart. And we usually keep the dogs here overnight so they can be calm. And we monitor for any adverse reactions. I have not had one yet, thank goodness.
Yeah.
Knock on something. Obviously, this is not wood.
No, but it works.
But we try to stage them appropriately. So if we have a dog who's in severe end stage, we let the people know of the risk, because some dogs are not a good candidate. You know, they would need to start on a treatment protocol for congestive heart failure, and some dogs need to just go straight to surgery to have the worms manually extracted through their jugular veins. You know, some dogs don't have that time to wait and start the fast kill treatment. But so it's a series of 3 injections over a span of 4 months, and we find that very effective. That's the recommended protocol for the American Heartworm Society. But like I said, there's a lot of owners that's not an option for them. The dog is too hyper, or the owner doesn't feel comfortable with the speed of that kill. They don't feel comfortable with the side effects. So the slow kill method, now I say that in quotations because a lot of your scholars, they don't recommend that, your institutions, because they think it's false advertising.
Okay.
It is a slower kill treatment, and basically what that is you start them on some type of preventative. Technically, there's 2 that we recommend. There's Advantage Multi, or there's HeartGuard. I lean more towards Advantage Multi because I find that it's really good at clearing like positive cases.
Okay.
So you do get on your monthly prevention. We do based on your microfilarial smear. If they have a lot of little larvae in the blood, I'll start them on prednisone also, so they don't react when I put them on their monthly prevention. And then, so you do every month, and then basically we do that same antibiotic that weakens the heartworms, the doxycycline. So we do that on twice a day, 10 mg per kg. We do that for 30 days, and then we do off cycle 2 months, then 30 days, and then off cycle 2 months. Typically, I do it for like a year and a half. I find that if it's going to get any benefit, you're going to get it in that first year and a half. Because unfortunately, with the demand of that drug, it is costly, especially if you have an 80 or 90 pound lab. The doxycycline can get pretty costly.
Okay. And cost wise, since you brought that up, what is the difference between the fast and the slow?
Well, in both treatments,
ballpark.
You have to be on that Advantage Multi or a heartworm prevention. So the fast kill treatment with the hospital stays and stuff like that, it can be anywhere from $700 to $1,200 total, roundabout, for those 4 months.
Okay.
The slow kill, you're paying for that monthly heartworm prevention and that pulse therapy doxycycline antibiotic. So the cost, it still costs. I mean, it's not cheap by any means either direction, but in the slow kill method, your cost is a little more spread out.
Okay.
And people like the slower kill method because you don't have to be as stringent with the cage restriction.
Okay.
Now, obviously, any pet that has heartworms, you really shouldn't let them go bonkers in the yard running and playing, because they have worms in their heart.
Right.
And the other con of the slow kill method is that during that whole time where the worms, you're basically waiting for those adult worms in the heart to pass away of old age. They're still going to be whipping around in there doing damage to your heart valves and everything.
Okay, so all that being said, is there anything else that you just want to convey to the viewers about heartworms, or what, just
please
your message?
Keep your pet on heartworm prevention year round. It doesn't matter. There are dozens of types of preventions, ranging in cost, ranging in levels of coverage. I mean, they all do heartworms. Some do heartworm and flea. Some do heartworms, intestinal parasites. Doesn't matter, as long as it contains heartworm prevention. It's awesome. I would hope you guys pick the best option or the more coverage options and get rid of those pesky fleas too. But at the end of the day, the heartworms are the most important. So you want to give that once a month their whole life. And it doesn't matter if the pet only lives indoors. I couldn't tell you how many people tell me, oh, a little Fluffy, she never leaves house. She pees on a little potty pad. And why do I need to spend money on that? Because it's South Louisiana. Has a mosquito ever gotten in your house before?
Because you have a hole about that big in your screen.
Yes. I mean, have you ever been trying to go to sleep and you hear beep? Mosquitoes are everywhere. You cannot have a mosquito-free household.
All right. Well, Dr. Anderman, thank you.
Thank you.
It's been pleasurable, and we'll be right back.